EtO is used to make other chemicals that are used to make a range of products. For example, anti-freezing agents, textiles, plastics, detergents, and adhesives. Ethylene oxide is largely used in sterilizing medical devices. So according to FDA, approximately 50% of medical devices are treated with EtO. EtO is also used to sterilize some food products, for example, spices, certain dried herbs, dried vegetables, sesame seeds, and also walnuts. SIRIM is establishing the ethylene oxide sterilization facility, which has 6 euro pellet chambers. So I'm trying to highlight that it has the 6 euro pellet chamber because we have the intention to address the SMEs' needs to sterilize their low-volume products. It has to be at a lower cost, which is only practicable for fewer cycles. The companies now would have an option to sterilize their products between 1 to 6 pallets in their timeline, and they don't really have to wait for turns to fit in larger sterilizing chambers. SIRIM is the first commercial low-cost and small-scale sterilization system in northern region of Malaysia. So we have the smallest chamber, which is providing the commercially low-cost, and it is also strategically available at Penang because Penang has the most number of medical device manufacturers in Malaysia. EtO sterilization plays a vital role in the supply chain of medical devices. The sterilization activity is the deciding factor for a product to access the market. Say, for example, when a company is sending in products over here, once sterilized, they will be able to send it for a market. It can be for marketing the product afterwards, or they can send it for product registration if it is a new product. So the sterilization activity finalizes the supply chain of a medical device. And then in terms of the health, I would say why sterilization is important. It is important because we are trying to prevent the hospital-acquired infections. And when patients are not exposed to microorganisms that could be present on a medical device which has not been properly sterilized, then we are exposing them to hospital-acquired infections, which means instead of getting treatment for another purpose, the patient could end up having infection, and that infection could be lethal. When we are offering such low-cost sterilizer for the companies will be able to invest more on the product innovation for a comprehensive R&D at lower cost. Best practices of controlling EtO emissions in air is by adhering to the DOE regulations, Department of Environmental Regulations, as per the guidelines given under Environmental Quality Clean Air Regulation 2014. So the system, our system in SIRIM will be able to emit around 0.2 ppm of EtO. And this is actually less than the DOE's requirement. DOE's requirement set around 0.55 ppm. So we are already adhering to the regulations, air pollution regulations. Our technician will be sent for a certified environmental professional in scrubber operation. It's called as SEPSO training, so that the technician has the capacity and capability to operate the scrubber, to continuously monitor throughout the year. It's very important because we wanted to make sure that the emission is always under control and doesn't exceed the 0.2 ppm. When we are talking about the safety, we are also practicing DOSH regulations to acquire permits to use pressurized vessels, electric boiler, and the lifting equipment. Lifting equipment is like forklift, reach trucks. So we have to get all those permits before we can use them in the premise.